So in the name of the Almighty, most merciful and beneficent. Previously I have asked in part 2 session it is, of the interpretation of the common X-rays. The answers of the previous one are as follows. I hope that you have written on the paper the diagnosis, the findings, differential diagnosis or management strategies if it is possible. So these were the instructions which I have placed down previously. The X-ray was given a 65-year-old and on antipsychotics presented in the emergency and accident department for severe acute abdominal pain and breathlessness. This was the scenario. The patient was fulfilling the requirement, although because of the pain he cannot stand. It is a PA view and a standing view by 1, 2nd, 3rd, 4th, 5th, 6th, 7th. Yes, he is standing and he is not still because he is slightly moved towards the left side. So he is not in the straight line. No, he is not straight because of probably pain in the lower part of the chest or the upper part of the abdomen. So this is the whole interpretation. If you see the parameters which I have told you, all are fulfilled properly, and we go for the protocol and seeing the soft shadows now. These are soft shadows. Here there are soft shadows and here below the dome of diaphragm soft shadows. You can see under the right dome of the diaphragm there is definitely the air which is present. The linear air shadow. Air under the right dome of the diaphragm as well as in the left dome of the diaphragm. Both are equal. Now the right is more normally than the left dome of the diaphragm. So sir, the thing is this, there is something else is seen. When a magnifying glass is used, properly seen, there is a bunch of something. It is just like a spiral shape of the type of a thing here present. And this is the part of the gastroesophageal junction, very near to it, this is present. The answer is that the patient has got the acute abdomen, there is perforation probably at this site, and the perforation occurred because of this. He was taking antipsychotics, and patient was a psychotic patient. He had taken anything available and engulf it, and it is an impulse which causes him to engulf. So he engulfed most of the hair of the scalp hair or the beard hair and engulf it. And here it is present, the whole appearance. This is called trichobazar. The trichobazar means that he has engulfed the hairs here, and it causes the inflammation and perforation there. So this is the trichobazar. So for the further investigation, you go for the abdomen, plain X-ray abdomen, to see the other parameters of the plain X-ray abdomen, the fluid levels, the intestinal obstruction, and so on. The lateral view can also be helpful. The most helpful thing which can be possibly here, it is possible for go to the HRCT to confirm your finding. And the management is, of course, other than that, is surgical. It should be repaired at once. The immediate laparotomy abdominal should be done, and the perforation should be repaired. A 26-year-old having the inspiratory stutter, this was the second question. Now all requirements are fulfilled in this X-ray, and here I see there, this is the trachea which is here, like going this, it is displaced towards the right side, this is the positive finding, and upper part of the middle mediastinum, this is the upper part of the middle mediastinum, just above it, there is opacity. Now, see the lining of opacity, this is coming like this, slightly irregular. This is a non-muscular shadow above the upper part of the middle mediastinum. So any mass can cause this, because it is anterior to the trachea. It causes pressure on the trachea and causes inspiratory stutter. So any mediastinal mass, any bunch of the paratracheal lymph nodes can press it, and more or least, rather I would say the least likely, it is maybe a substernal goiter, or it may be topic type of parathyroid hyperplasia. This is the differential diagnosis of this opacity. The further investigation we will do the lateral view, the HRCT should be done to confirm it, and if it is possible, the biopsy should be taken. And the treatment is that you go for if it is substernal goiter, then you go for the thyroid function test to assess the activity of the thyroid gland, and the treatment is basically to remove it. That is surgical removal of this mass, which is probably the retrosternal goiter, most probable diagnosis. The other X-ray which is shown here is a 35-year-old smoker, and there was a history of a seasonal wheezing. He is an old asthmatic seasonal, and with the old smoker. Now the positive finding in his X-rays are in the lungs. She is a female, and there is a lower border of the breast shadows are visible. Now compare all the lung fields, 6 lung fields, compare it. Bronchovascular markers are very, very decreased in amount, and there is hypotranslucencies are seen. Intercostal spaces are white, you can see, and the dome of the diaphragm are flat, and there is slight tenting here. Dome of the diaphragm are flat, slight tenting here, and there is the heart is small. Because the heart is small, it is not microcardia. We don't say it is microcardia, but what is called is the straightening of the cardiac shadow. These are the findings, and the basis of these findings and basis of the scenario provided. Now this is the COPD, and is a polar end of the emphysema, and dominant emphysema. Other investigation you will do, other than that, possibly the HRCT can be done, the sputum should be done through DR, and the AFP usually we do in our country specifically. And we do the pulmonary function tests to see that it is 100% obstructive lesion. Yes, it is. To see the assessment of the pulmonary function tests, and then we go for the management plan of the COPD dominant emphysema, and that is cessation of smoking, the bronchodilation, dilators of different types can be used. If they are failed, we go for the anticholinergic like epinephrine bromide. If it fails, we go for the steroid inhalations, or steroid will be given orally. The surgical aspect of the disease, that the partial nephrectomy can be done to increase the size of the thoracic cavity, which is increased, it will be reduced, and patient will be out of symptoms. And there are other surgeries are available as well. The carotid body resection, etc. These are the possible new advances they have. So this is the another one of 40 years old having the purulent expectoration, and there is grade 3 digital clubbing, very close. You see here, this is the trachea which is moving like this. From here to here, on the right side 10 degree is normal. The other positive finding is X-ray. The lung fields are definitely disturbed, lung fields, abnormal. Bronchoscopic markings are touching on the left side here. See most of it. And on the other side, the thickened, you can see bands of fibrosis are seen, the reticulations. There are macro reticulations are seen, and they are crossover bridging and causing the impression of honeycombing with fluid levels. You can see this is the fluid level, this is the fluid level, this is the fluid levels. Adding the scenario with these findings and also the flattening of the dome of the diaphragm. The patient has got the COPD, and the element of the chronic bronchitis is there, but it is more than the chronic bronchitis, because this part of the lung is much severely affected with a purulent expectoration, means that he has developed another variant of the chronic obstructive pulmonary disease that is called bronchiectasis, obstructive nature of the disease. So bronchiectasis is the final diagnosis, other than the other differential which I have already made. The other investigation you can do are the lateral part of the chest vein, or HRCT should be done. The sputum will be examined for the DR culture and sensitivity, and you will do the pulmonary function test and other routine examinations, investigative, should be done. Management in this case, you have to remove the cause. If the patient has got smoking, he should stop smoking. Other thing you can do, the broad spectrum antibiotics should be used for a very prolonged period of time, postural drainage. These are the possible management of this. And if it all are fail, in some part of the lung where is a much cystic changes are seen, it should be removed by the surgical manipulation. This is the last one X-ray which I have shown you, that the infertility of 35 years old woman, history of the purulent expectoration since 10 years. It is one of the easiest X-ray of these. The all requirements are fulfilled. The positive finding this X-ray is the aortic nickel is seen on this side. The apex of the lower part of the mediastinum means heart is here on the right side instead of here. And the gastric aerogram is on the right side. It means that this is the stomach part on the right side, and this is the liver part. So it is the reflection of the normal mirror image of the normal X-ray. The right side, it is the right side. It should be written on this X-ray, it is not written, but this is the right side, it is the left side. What is the diagnosis of this X-ray? Dextrocardia with the other viscerals which are also displaced to the other side. It is one of the congenital type of the diseases, and this case has got the infertility. It may be associated with what is called the hypomotility of the cilia. It can cause the stasis in the nose, causing the maxillary sinusitis, chronic. It can cause the expectoration because the ciliary movement is very, very less. It can cause, again, the hair is concerned, again the ciliary movements are required. It may cause the malabsorption. It can cause the infertility because, again, the cilia should be present in the fallopian tube and other part, which displaces the ova which is generated from the ovary. So hypomotility of the cilia will cause the infertility, and the syndrome is called Kata-Jenner syndrome. And the further investigation of this case, the important thing is the Kata-Jenner syndrome is that the congenital heart disease will not be associated. The important thing is this. If it is without Kata-Jenner, means it is dextrocardia only, or in the middle axis of the heart is in the middle, that is called mesocardia. The other congenital heart abnormalities are usually seen, sir, like the ASD and VSD and the patent ductus arteriosus are possibilities. But in this case, there are least chances. This is the advantage of the Kata-Jenner in comparison with the dextrocardia. The HRCT should be done rather than a clinical examination will show where is the apex, where is the gastroenterogram, where is the liver percussion, dullness. You can do the HRCT and confirm it. You can do the electrocardiography and you can confirm it. The treatment is nothing but just to mention it as a prudent expectoration. So the treatment is for the COPD. In this case, just like previously told you, that you will enhance expectoration by the postural drainage, the exercises, chest exercises, and the broad spectrum antibiotics for a prolonged period of time. These are the few axes which I have shown you. I hope that you have enjoyed it. Good luck. And here in Pakistan, good morning for everybody, and wish you good luck in your future examination.